this latest variant, which is BA.5, a small increase in the number of hospitalizations and deaths with it. So while we initially thought it was less virulent or less aggressive, maybe is a better word, we are seeing that uptick in people being infected and hospitalized. We do have good therapeutics to treat COVID-19, and they appear to still be effective against the BA.5 variant. So I want to encourage people to be educated about what's out there and know who qualifies for treatment when you think you're sick, and go see your doctor just in case they don't suggest it. And if you go to the CDC website, you can see who qualifies for treatment and what the different therapeutic options are. The variant that is circulating now is BA.5, and when it first reached Washington at the beginning of June, it took only 6 weeks to become nearly 3/4 of all cases, and now it is 3/4 of all cases. It's just to go to show how the variants act differently. So BA.5 tends to be extremely transmissible, and what we're seeing is a much shorter time from when you're exposed to when you start exhibiting symptoms. And then generally people test negative on the first or second day if you're doing a home test. But if you go to the hospital, you could have a positive PCR test. The therapeutics that are available are able to be used within the first 5 days, or in the case of some of them, 7 days.
I'm sorry.
Yeah, go ahead.
You said it's much quicker, I guess you could say, testing time. So if I'm taking an in-home test, let's say, which probably 80% of the people out there are doing now,
right?
If you test within the first couple, it may not be accurate to test 3 or 4 days in. Is that what you're saying?
Absolutely, yes. The latest variant is BA.2.75, and it was identified in early June in India. It has not yet reached our shores, but it is expected to reach here. Why do we keep talking about the variants? It's just because they do behave differently. If you remember the initial variants Alpha and Delta, people were really sick and a lot of people died. And pathogens tend to mutate in the direction of being less virulent, in other words, less deadly, but that's not always the case. And so that's why we're keeping an eye on these variants, is to identify their different behaviors so we can better inform people how to be treated for it, and if there would be coming a time where we would all be really nervous about congregating again.